Hi, I'm Pete Anderson, a group learning expert with Blitz Health, an industry-leading peer-to-peer engagement and education provider. We've seen the impact that the recent OIG fraud alert has had on biopharma's ability to implement compliant speaker programs. We have a proven peer-to-peer solution. It delivers the education healthcare providers need to better understand therapies to improve patient care. Our peer exchange format meets the stringent requirements that define compliant educational engagements, while also allowing brands to expand their reach. We recently recorded an actual program using this innovative format that had participants from around the country. Here are a few clips of their reactions to the format.
And that's why I have these questions. What's the value? How likely are you to attend? What are the advantages here? How often do you get to speak to your peers in this kind of setting? And is there value there? And please be frank. I really want to hear what your opinion is.
I think that the value is great when you get to talk to your peers, because sometimes we just get caught up in our own little sector of where we practice. And when we're talking to our peers in other cities or the other side of the United States, we get an appreciation for what they do, but also we're able to take away small nuggets that may help us in our own practice. And then it gives us kind of like a bigger view outside of where we're practicing of what's going on.
I was fortunate to spend time in Iowa and spend time in Nebraska. And the people have different needs, and sharing them, I think, is important. And just getting those nuggets out there are so helpful.
Dr. Chen, you're in primary care. What kind of conversations are the ones that you would want to attend?
You know, this kind of conversation is good because everybody practices a different state, and some is a rural area, some is in the big city. You know, rural area doesn't have a lot of resource, but like we practices have a lot of resources I can utilize. So this is let us understand, you know, how the hardship people practice in rural area, and what the resource they can use it to do the best for the patient.
I think this is a sort of a divergent group of people, you know, from all over. But I think that the other part of it should be that people in the same area should be doing the same sort of thing, sharing, you know, their experiences, you know, the deficiencies, the things that work.
To see other people in different states and different ways of approaching things. I mean, it's eye-opening. It's great. It's really very helpful.
So yeah, I believe that it is wonderful, and I would love to participate.
Thanks for watching. Contact us to schedule time to see additional insights from the program and explore how this format can complement your traditional speaker programs and benefit your ever-changing brand needs. Thanks.